Okay, so now we're going to talk about pulmonary artery hypertension. Pulmonary artery hypertension is when there is too much blood going through the pulmonary vessels, or when those vessels are constricted. It's increased blood pressure in the vessels that go to the lungs and come back. Okay, the vessels that are going to the lungs to be oxygenated and come back. So specifically, we're talking about pulmonary artery hypertension. So think about the pulmonary artery going from the right side of the heart to the lungs. The pressure is too high. So it can be idiopathic, or primary pulmonary hypertension, which means it just is, and we don't know why. And that's usually a constriction issue. There's too much vasoconstriction. It can be a left to right shunt due to a heart defect. Remember that a lot of those heart defects send too much blood through the blood vessels that are going to the lungs. So if we increase the blood volume, we have pulmonary hypertension. It can be due to lung disease because those vessels are going into and around all of the lung tissue to pick up oxygen across the alveolar membrane. And so if that tissue is stiff and hard and damaged, then it takes more pressure to get the blood through that lung, to get the blood to go through those vessels that are going through the lung tissue. So it can be due to lung disease, or it can be due to disease or damage to the pulmonary vessels. And remember, when we have blood chronically going that shouldn't be going through those vessels, it damages them. So those are the things that can cause pulmonary artery hypertension. So what happens, increase pulmonary vascular resistance. That means it's harder to get blood through the vessels on the right side through the lungs, leads to right side heart failure. If there are open defects, and remember, one of the causes of this is that we have defects that allow blood a left to right shunt. Well, if there's enough pressure from the damage, then we may have a right to left shunt. Okay. If we have a right to left shunt, we decrease how much blood's going to the lungs, so we decrease oxygenation. So this patient is going to have hypoxia. But trying harder to push blood through those tight vessels, or too much blood through the vessels, the right side of the heart hypertrophies. And so then if it hypertrophies enough, there's less room for blood. So that decreases output as well. Okay. So what does it look like? This patient tries to do something, they increase their activity, and they get short of breath because they cannot increase the amount of blood picking up oxygen in order to meet that oxygen need. So they get short of breath with activity. They have chest pain. Okay. They may pass out because they can't get enough oxygenated blood to their bodies. It can lead to coronary artery occlusion. Remember that muscle builds up, the heart muscle builds up, so it's trying harder and harder and harder to pump. So it builds up and gets thicker. Not only does that leave less room for blood in the ventricle, but it can put pressure, because the muscle is bigger than it's supposed to be. It can put pressure or crimp off, decrease perfusion of the coronary arteries. So they can have angina or a heart attack. They're at risk for blood clots. Pulmonary hypertension is progressive and fatal. It tends to gradually get worse. Management is focused on slowing the progression and improving the quality of life. So for this patient, we want them to avoid hypoxia. We want them to limit their activity, avoid high altitudes. They don't get to go climbing, things like that. They need supplemental oxygen, especially when they're sleeping, to make sure they're getting as much oxygen as they can. They need anticoagulants for their risk of clots. They need vasodilators to try to help open up those pulmonary vessels so they can get more blood through the lungs. They may get calcium channel blockers. And there's a new drug called bosentan that works on the endothelium of the pulmonary arteries. So the goals of care are to open up those arteries as much as possible to allow as much blood to be oxygenated as possible. Okay, in the next section, we're going to talk about cardiomyopathy.